okay? Now, you're gonna use a baby wipe to cleanse off the area first. Again, you're not using alcohol. You're gonna apply your 2 millimeters of ultrasound gel, and then I kinda wanna go through, I have all my little notes here for you guys that'll help you. This is how you're gonna actually do the protocol itself, and this is how you decide on the face what modes to use, okay? So we have this chart in gray for a reason, because I'll give you an example. When I was working in the operating room, we would have some patients come in who were in their mid-60s who had very thick skin. If you look at this chart, it's telling you up to age 45 thick skin. So it's not always the case, right? It's a case-by-case basis. So you can kind of tell if somebody's got thick skin, if they kind of have like dilated pores and whatnot, and you just feel it, right? You can feel that thickness. So use this chart as your guideline. That's a great fallback, but just keep in mind, sometimes maybe it's a little bit different and you can use your clinical judgment. Up to age 45 thick skin, we're saying that you can use mode 1 for 2 passes on the face, mode 2 for 4 passes. So if you add the 2 and 4 together, it's a total of 6 passes, right? What you're gonna do is you're gonna start medial and you're gonna work lateral, all right? So for instance, just pretend this is my ST, okay? I have my 2 millimeters of ultrasound gel on the face and I have it all globbed up everywhere, 2 millimeters. You start here, you're gonna pulse on the trigger, you're gonna wait for the beep, you're gonna pick up, 10% overlap. Pressure, pulse, pick up. You're just gonna keep doing that, okay? That's my first row. My second row is gonna come right here, right above it. And you're just working up towards the eye, okay? Second one's gonna come right next to the corner of the mouth here. And now your fourth one, your last one, is gonna come right under the cheekbone, almost like a Nike swoop, okay? You're gonna follow the anatomy, and you're gonna scoop underneath that cheekbone, because that's what we wanna contour, right? We wanna like pop that cheekbone for our patients, okay? That's your fourth row. Now, you're gonna do your fifth row over the nasolabial fold, because that is an area of concern for a lot of people. You're gonna take your electrodes, you're gonna go directly over that nasolabial fold, okay? Now, you're gonna go over it one more time, by changing your electrodes this way, okay? So say I had my electrodes like this, I call them the 11s, now we have equal signs, and you're gonna go over it one more time. We call that cross-hatching, okay? That's 1 pass. You're gonna do that 5 more times. Each time you complete a pass, you're going to take gauze, clean off the electrodes so that ultrasound gel doesn't get dry on there and prevent the thermoelectric cooling from working. You're gonna throw that in the garbage, smooth out your gel, add more if you have to, and then you're gonna do your second pass. And that's how it works on the lower face, okay? Each time you do a pass, you also want to crosshatch. So if I had my electrodes like this, the first time around, the next time around, I'm gonna go like this and flip them. And I'm still working in the same direction, medial to lateral. I just changed the direction of the electrodes, ultimately, okay? And I will show you guys how to do that this afternoon, just to clarify that.
And what do patients normally say, like, are they feeling anything afterwards? Like when they go home, do they come back and say, oh, I noticed that, like, some kind of feeling?
Maybe a little heat.
Still heat?
Yeah.
Pulsation, does it get like have a pulse in it, anything like that, I wonder?
Not necessarily, no. I think they hang on to that heat, that buildup of heat that we've created for the most part. And then we'll talk about post-care guidelines in a bit too, but there really isn't much to worry about. I always will have people, if you do decide to start, if you have a skincare line or anything, if you have SPF here, you can just give them a little sample of that, like put it on a little popsicle stick.
And what's your SPF?
Well, I mean 50, yeah. 50 is always good, yeah. Yeah, I could give you like a good brand too, that's inexpensive but efficacious. Elta MD, so it works really well. Like, and the reason
What is it called?
Elta MD, ELTA MD. Yeah, and it's affordable for your patients too, you know. So I really like it. It's a sunscreen like based company. I mean, all their and post care serum also or treatment. So they have physical sunscreens, they have chemical sunscreens, they have tinted, they have non-tinted, they have some for those who are always out in the ocean and they need waterproof. I mean, they literally have a sunscreen for everything.
Between the 30 and the 50.
Honestly, I don't know that there truthfully is much after 30, but I mean, a medical grade sunscreen is really what you want to recommend. So if you can like carry something like Elta MD that's affordable to them, using it is to say, hey, you know, you just did your ST treatment, here's a little sample of this L to MD, just pop this on before you leave. They may come back 2 weeks later and say, hey, what was the name of that SPF? I really
And what
like
is it
that.
gonna do for them?
So it's just gonna protect their skin, yeah, so we're not necessarily,
Because, like,
it's colorblind radio frequency, so all skin types, you don't have any waiting period
Mhm.
for anything, it's great for that. But if you're putting heat on anybody's skin, if somebody's a Fitzpatrick 4, 5, or 6, the risk for PIH could still potentially be there.
Yeah.
I have not run into that personally, but it's a possibility. So for that reason, placing SPF on the face is important when they're going outside after these treatments. It's also
It doesn't
important.
matter if it's sunny out or whatever.
Yeah, it doesn't matter.
It's just
Doesn't
when
matter.
Because even with the clouds.
Right, right.
The heat
That
that's
UV
like-
index, yeah,
Mhm.
exactly, yeah, so it doesn't matter if it's cloudy out, that's when I always get sunburnt, because I'm like, it doesn't feel hot, but here I am,
It
bright
is.
red, it's like March, but, so yeah, you just wanna make sure that they're doing that, they're not taking like a super hot shower maybe for the next couple of days, using any abrasive or harsh products for the next couple of days on the skin, just, you know, giving their skin a little bit of a break, we just put some heat in there.